Good morning, everyone. Thank you for joining the Ohio AAP Kickoff Education Fundamental Prevention. This is the first of six additional trainings that we'll be having on vaccines, obesity, and immunizations. And we're excited to have this first kickoff training today. Here's a list of the other trainings that we are going to be having available. Our next training will be on October 12th on vaccine hesitancy, and then November 23rd on vaccine health, and December on lead. And then our next trainings are still being scheduled. And we hope that you can join other trainings as well. Our speakers today are Dr. Chris Peltier with Cincinnati. He's a pediatrician in Cincinnati. And then we have Bridget Hobson, who is a certified clinical community health worker. And we're excited to share this information with you all. At this time, I will pass it over to Dr. Peltier to introduce himself, and then Bridget will speak after him. If you have any questions, please put them in the chat box. And please keep your lines muted and your videos off during this time.
Thanks, Alex. As Alex said, my name is Chris Peltier, and I am a pediatrician in Cincinnati in private practice. And I'm also have the honor of being the president-elect of the Ohio chapter of the American Academy of Pediatrics. And I'm really excited to be a part of this kickoff session. I think this series is phenomenal, and it's so key to what we were doing as pediatricians and healthcare providers, not only before the pandemic, but so much more important even now to sort of highlight these prevention strategies to make sure that we're optimizing the health of our children during the pandemic. So just some brief objectives. Today, we're going to look at some fundamental prevention aspects of pediatrics. We're going to just very briefly introduce you to some Ohio AAP resources that you can use in your practice and with your families. And then we're going to begin to dive in a little bit on some of the topics that Alex mentioned: lead screening, obesity prevention, and immunizations. Next slide, please. So let's just briefly, and again, this is going to be really just sort of a high level overview. And then as the series progresses over the next several months, we'll get into much more detail, but really just wanted to start talking about some of these important topics. So the first one we're going to look at is lead screening. So as many of you may know, that Ohio law requires blood lead testing at both 12 and 24 months of age for children that really fall into one of two categories, that are either covered and insured by Medicaid or who live in a high-risk zip code. The reality of the situation is that only about half of those children that meet those criteria are currently being tested. Now, there are some state and local resources to help families with children who have lead poisoning, and we're going to expose you to some of those. And then not only, we often find that when we screen that not only do we identify lead poisoning, but we also identify iron insufficiency, which also increases children's risk for lead poisoning. Next slide. So, and again, many of you know this, but why is screening for lead so important? Well, we know that lead toxicity can cause many deleterious effects in our children. It can cause developmental delays, it can cause cognitive problems, and then also behavioral problems and decreased attention span that sort of then carries and spills over into struggles in school. And it also can have lifelong consequences if not identified and treated. Those cognitive and behavioral problems can persist. And there are sort of effects on many different organ systems within the body.
Oh, wait. Oh.
Sorry about that. Such as cardiovascular and immunologic. And that cartoon at the bottom is a really nice, just kind of sort of graphic that sort of shows you all of the different areas in which lead toxicity can affect our kids. Next slide, Alex. So as I said, the two sort of hard stop high risk categories are that for screening lead is if your child is on Medicaid or if they live in a high-risk zip code. But then there are also some other screening questions that we know put kids at a higher risk of lead toxicity. So those families that either live in or regularly visit a home or building that was built before 1950, or that was built before 1978 that has deteriorated paint, or a building before 1978 that has current or planned renovation or remodeling. And I think it's important to remember that when you ask those questions, if you're not doing it on a paper screen, to not only say, do you live in a home, but also maybe visit a home, right? So I think sometimes we forget to ask about, you know, you may live in, your family may live in a home that does not meet these criteria, but they spend 8 hours Monday through Friday in a home care setting that maybe do meet these criteria. So I think, or they may spend most of their time with a grandparent that lives in a home that meets these criteria. So I think it's important to not only ask where the child lives, but where they may spend significant amount of time. Other high-risk situations include having a sibling or a playmate who has or did have an elevated blood lead level. Frequently encounter an adult, so a parent or a caregiver who has a lead-related hobby or works in an occupation that may expose them to lead. And then if the family lives or the child spends a significant amount of time in a home that is near an active lead smelter, battery recycling plant, or another industry that's known to generate airborne lead dust. Next slide, Alex. So testing, right? So capillary testing is acceptable for screening purposes. However, medical and environmental testing should be planned based on venous confirmatory tests. So if you have a positive capillary test, that should obviously be followed up with a venous confirmatory test following that positive capillary test. And again, that level, when you should do a venous confirmatory test, if you have a capillary blood lead test that you do in your office that comes back at 5 micrograms per deciliter or higher, and then all future lead level testing for those children should be venous testing. And follow-up testing guidelines are available at the ODH website. Next slide. And then again, you are going to get access to all of these resources. There's a very nice interactive map of the state of Ohio that you can just move your cursor to the county that child lives in by zip code, and then break it down to zip code and find out if they're in a high risk area. We have RAT cards that are available that talk about the importance of lead screening for families, and then a resource guide for physicians. And I do want to make a comment about testing too. Oftentimes there's really a couple of different ways that you can perform lead testing. So obviously the first is if you do no testing in your office. And so in that case, you would then refer your families to your local children's hospital or a lab that could perform those tests, right? So the positives of that is that you don't have to invest in a lead machine and have upfront the costs of that. The downside, of course, is that you are ensuring that you have to ensure that your families are going to follow up, right? And we know that that's a barrier, especially if they don't have transportation or getting to those testing sites. So again, of course, you could test doing capillaries, sort of point of care tests where you do a capillary stick and you have a machine that runs the test in your office. The good news is that you will, as long as you remember to do that test in the office, you're going to capture all of those at-risk patients. The downside is that, of course, is sort of the upfront cost of the machine and the ongoing cartridges for that. There is another option that actually is what my office does. And we have partnered with Cincinnati Children's Hospital, where we do a capillary stick and place it on a piece of filter paper, kind of similar to the newborn screening test procedure that Cincinnati Children's provides us with. And then we then send those filter paper samples to Cincinnati Children's Lab, and they run those for us. So it really, for us, it met sort of the best of both worlds. It allowed us to capture those patients while they were in the office, and we don't have to worry about, do we need to follow up with those families? Did they really go to get that test done? And then it also meant that we didn't have to front the cost of a machine and the ongoing expenses of that. So I would encourage you, if you practice near a children's hospital or a lab facility, maybe inquiring if that could be an option for you if you're not currently testing in your office. Next slide, Alex. And then also, so this is a very comprehensive toolkit on lead screening and lead prevention that also the chapter is going to provide for you throughout by participating in this project. Next slide. So going to switch gears a little bit and talk about obesity. You know, again, we'll sort of talk about pre-pandemic and pandemic. And unfortunately, we were seeing a rise in childhood obesity and the risk of being overweight pre-pandemic. You then throw in the fact that, you know, for several months, we were basically shut down and quarantined, and kids were not getting outside, and they weren't going to school, having physical activity at recess, they weren't playing sports. And we really have seen throughout the pandemic just a marked rise in the number of kids that are overweight or obese. We know from studies that have been done that during those first 1,000 days, so really from birth to 2 years of age, are really sort of a critical period, not only for things like brain development and cognition, but also for childhood obesity prevention. And it really sort of signals that window of opportunity where we can work with families to sort of instill healthy nutrition guidelines and practices for those young children. Obviously, it goes without saying that we really need to provide messages and strategies for caregivers to improve dietary weight, to really affect healthy outcomes in children. And really starting during infancy and as those children grow during those first 2 years of life, you know, sort of counseling families and providing anticipatory guidance on not only what, but how to feed infants and toddlers within that context of the growing child and positive and responsive parenting. Next slide. So again, this is one of the chapter's most successful programs, Parenting at Mealtime and Playtime, or PMP as we call it. And there is an app that you will be able to download through which you'll be able to access many of the different handouts on nutrition and parenting. And there's the website. And again, Alex will be getting you all of these resources throughout this program. Next slide. And again, here are just some of the handouts where we talk about sort of age specific and appropriate nutrition, as well as the importance of play and recognizing hunger and fullness, and many, many other resources that our content experts have put together. Next slide, Alex. And then again, it's sort of a comprehensive toolkit for which all of those resources are located. And again, I will say you will have access to all of these resources. Next slide, Alex. And then really want to sort of wrap up this very brief overview with probably the topic that I'm most passionate about, and that's vaccines. So according to a recent study from the National Immunizations Survey, only about 2/3 of Ohio babies have received all of the immunizations recommended to keep them safe from vaccine preventable illnesses. And we do much better for teenagers. About 85% of them have received the tetanus whooping cough or Tdap vaccine, and 87% have received the quadrivalent meningococcal vaccine. The rates for HPV vaccine are still very, very low for both boys and girls. Next slide. So this is just a copy of sort of the vaccine periodicity table from the CDC, the American Academy of Family Physicians, and the American Academy of Pediatrics. Again, you all know this. I'm not going to go over this, but just a couple of points. You know, obviously there are, as you know, there is some flexibility within the vaccine periodicity table. So depending on when your practice may decide, for instance, my practice, we do MMR, varicella, Hep A at 12 months, and we do Hib Prevnar at 15 months. Other practices will flip that. Again, I think those are sort of fine points and really what works best for your practice. You know, I would encourage a couple of things. If you have patients that, if you have patients with Medicaid and you are not enrolled in the Vaccine for Children's program, I would highly encourage you to do that. Again, it's all about access and ease of administration. Just like we talked about with lead screening, if you're sending your patients out of your office and asking them to go to the lab to get lead screening, automatically there's a great chance that that's not going to happen. Well, the same thing's going to happen if you do not stock Vaccine for Children vaccines for your Medicaid patients and you're sending them out to your local health departments to get their vaccines. There's a good chance that those families aren't going to get them done, or they might not get done in a timely manner if they do get done at all. So it's really important to be able to provide vaccines. Alex, I'm assuming at some point when you guys are doing the immunization portion, you're going to be talking about the Vaccine for Children's Fund. And there's a program, and we actually have a whole entire other separate program on vaccines for both children and adolescents within the chapter. And there's currently a bipartisan sponsored bill in Congress looking to strengthen the VFC bill by giving some incentives to providers who participate in that. Unfortunately, the bill has gotten weakened a little bit to get it through, but it still helps increase the payment for vaccine administration and some other things that really will hopefully incentivize practices that aren't VFC providers to become VFC providers. Next slide, Alex. And then again, I feel like we have to look at everything through the lens of the pandemic. You know, obviously one of the big things we saw during the quarantine in the spring of 2020 was that many families did not feel comfortable going to their pediatrician offices for well child care and immunizations. And so the chapter has done an extensive amount of work on communicating to the public that its pediatricians' offices are open, they're safe to go to, and really getting that message out of why it's so important to stay current on well child visits for making sure that you're up to date on your vaccines, as well as all of the other screenings, some of which we briefly touched on with lead screening and nutrition and growth. You know, we are in the middle of obviously this COVID pandemic. We surely don't want to have to be dealing with an outbreak of measles or an outbreak of whooping cough or an outbreak of meningitis on top of, you know, our healthcare system. I don't think could honestly handle another major epidemic on top of the one that we're currently dealing with. And then, of course, with COVID vaccine now approved for age 12 and up, and hopefully with the news yesterday that Pfizer's data shows that it's very safe and effective for kids 5 to 11. And we're hoping that in the next month that will be approved. Just the importance of why it's so important for our kids to get vaccinated against COVID. We have some great resources. And in fact, I think the next lecture in this series is really going to focus on vaccine hesitancy, especially in some of the underrepresented minority communities. Next slide, Alex. So again, just going to briefly expose you to some of the resources. So the chapter has a fantastic sort of web-based app that you can use on your laptop or your phone. It's the Fast Facts, and it's really meant really more for parents and for patients, and really, you know, with answering questions, frequently asked questions about vaccines. You know, why do we have vaccines? What do they protect against? Are they safe? So lots of questions and answers from experts within the chapter. Next slide, Alex. And then I just want to, if you're not familiar with sort of a subgroup within the Ohio chapter, the Ohio Champions for Vaccines, or OC4V group, is really a group of healthcare providers, parents, industry leaders, grandparents, anybody that has a passion and feels and realizes the importance of vaccines for our children are encouraged to join this group. So if you have not already, we would ask you to go to the Ohio AAP website, ohioaap.org, click on the OC4V page and take the pledge that you agree to advocate for vaccines by spreading accurate information about disease burden, safety, and effectiveness of vaccinations. You know, there's so much misinformation that's being spewed in media and on social media that it's important for those of us that really truly believe and know that vaccines are safe and why they're important for our voices to be heard. Next slide, Alex. And then we have a new resource that I believe Alex has either already sent out to you or will soon, that really talks about the importance of well child visits. And I hinted to that, right? So not only are well child visits important, obviously, for vaccines, but there are so many other things that we do in a well child visit, as you're aware of, right? We talked about lead screening, screening for obesity, developmental screenings. Obviously, one of the biggest ones that we're seeing that the pandemic has affected is doing mental health screening. So all of those reasons why it's important to let families know that well child visits are important and that it's safe to go to your pediatrician. Next slide, Alex. Well, again, that was just sort of an overview of some of the topics that are going to be covered during this program. I'm so glad you all have decided to participate in this, and all of these topics will be dealt with in much more detail over the coming months. And it's now my pleasure to turn it over to Bridget Hobson, who is a certified clinical community health worker, and she's going to talk about really the role and impact of community health workers on some of these topics that we introduced. Bridget?
Thank you, Dr. Peltier. Again, I am Bridget Hobson, a clinical community health worker. I'm working in the capacity of not only just working with children and obesity and immunization and lead, but I also assist the providers with colon cancer screenings, diabetes, high blood pressure, so forth and so on. Can you advance the slide, Alex, please? I wanted to share with everyone something that Dr. Peltier touched on in his presentation in addressing what we call the social determinants of health. These are limitations on the ability of traditional interventions that impact lifestyle modifications, programs, health behavior, counseling, access to resources, and to be effective for underserved populations. Social determinants of health are the conditions in which individuals are born, live, grow, work, or attend school. Social determinants of health also include economic factors, education, social support, culture, neighborhood, stability, and access to health care. Such factors may create barriers that to implementing health behavior changes. Can you please advance the slide? For example, with obesity intervention often center on promotion of healthy eating and exercise. However, family poverty limits the ability to afford nutritious foods and physical activity programs. Neighborhood poverty is associated with fewer healthy food stores, more fast food restaurants, fewer parks and fitness facilities, and limited safe areas to exercise. In addition, obesity intervention often requires frequent clinic visits, yet barriers that are disproportionately experienced by families with low income socioeconomic status, such as limited transportation options or lack of paid sick leave, inhibit ability to attend intensive treatment. Please advance the slide. So looking a little bit more closely percentage-wise with social determinants of health, the role in health, socioeconomic factors, 40%, health behaviors, 30%, healthcare, 20%, and physical environment, 10%. Addressing the SDOH and reducing childhood obesity disparities will require an upstream approach to obesity prevention and treatment. Upstream interventions are actions that are taken to address the health of populations within their social context prior to reaching the healthcare system. Such interventions address the root of health conditions such as obesity and are informed by the understanding that health does not occur within a vacuum, but is intimately linked to social, economic, and environmental factors. So a little bit of an example, kind of with the previous slide, the population that I specifically work with in the clinical aspect is in a low income economic area. There are no grocery stores. There are no parks. There's pretty much, there's pretty much nothing, I don't mean to get choked up, in which families can have better choices and options. And so one of the primary things that I do is in having more of a knowledge and ability to go out into the community as well into other communities to see what other resources are out there available that can be brought in, to the community that our patients live in, and to help them have better access to, like we have some food pantries. We work with the Cleveland Food Bank. We work with, there's some produce markets, some other organizations that we also partner with, and that we can refer patients that come in who need specific help and resources to help them be able to better manage their healthcare, getting prescriptions, helping them with situations in regards to their health insurance. A lot of people don't know what's available to them. And so part of my job is to advise them, educate them, and then help them link to those services through their health insurance, for example, that can provide transportation to them, that can provide opportunities, for them to help them get their medication, so forth and so on. Can you advance the slide, please? One potential upstream method for reducing disparities is to include community health workers in childhood obesity-led interventions and immunization education. CHWs are frontline public health workers who are trusted members of and/or have an unusually close understanding of the community that is served. Community health workers are increasingly being involved in healthcare delivery and work in communities around the nation in settings such as primary care, schools, and home health agencies. Some of the things that we can do and that we do are outreach to inform families about interventions, social support and guidance, and understanding the importance of prevention, connection to relevant local resources, and I did speak on that a minute ago, and actionable strategies for overcoming social determinants related barriers. Help individuals capitalize on social determinants of health related strengths such as strong community cohesion, resilience. If there's something going in the community that is positive, that is healthy, we encourage the residents of the community to get involved, even if it's not within a direct contact, obviously because of COVID and pre-COVID. But we do inform them of, what is taking place within their community and or within their neighboring community that can be definitely helpful and a benefit to them. And then opportunities to help individuals manage other complex health conditions, such as diabetes and high blood pressure. Something specifically where I use the PMP information, and I absolutely just love it. I wish I would have had it with my children, the app. We have our OB clinics on Wednesday. And so I get a lot of patients referred to my office because I'm able to link them with tangible resources, to help them get prepared, for their baby and or if they already have children. And that is an opportunity where I can bring up on my phone. Now I share this briefly. My children are in their 20s, but I have this app on my phone and I bring it up to, to show the patients how, helpful and beneficial it is to have that app on their phone, how, they can click on it and go right to some information that can be useful and helpful to them. And so I really love sharing this information and materials with patients that come into my office. Thank you.
Thank you, Bridget. I just have a few questions for you.
Okay.
What are some ways that community health workers can work with primary care providers to encourage visits, attendance at their well visits?
Okay, well, one thing is we do outreach via the phone. We can call the patients. And as a reminder, or one thing I'm able to do, I can go into their charts and I can see, well, we haven't seen you in a year, or, there's some follow-up you need to do on, some maybe test procedures or something like that that the doctor or the provider has wanted you to do. And so being able to have that brief conversation, hearing a live voice, not somebody recorded, speak to them and say, we really would like to see you. We need you to come in. I can schedule an appointment to come in and we can get you updated on. A lot of patients speak to me about medications, if they're having an issue with medications. And so I direct them through, we have what's called My Chart, I'm sure that's universal, where they can reach out through text message or however to, speak to the doctor in relation to helping them if they have a concern or something about their medication. Also, when they're in the clinic, getting them while they're here. For lack of a better term, I say capturing them while they're here. When they're in the clinic, that is an opportunity for me to, hi, my name is Bridget, I'm a community health worker. Can I provide you with some information regarding, food pantries or produce, or I have a community board out in the area where it has a plethora of information that may be helpful to them or someone they know. When they come into my office, that's a little bit more of, in a way, an intimate opportunity to, one-on-one, go through the information with them to help them, make sure they better understand what it is that, the doctor, information that the doctor has given them. And if they understand it, or, do they need any other support or, resources in regards to that. Within the clinic that I work in, the doctors, they trust that I know what I'm doing. They handle all the medical, which is great. And then I handle all the social service aspect of it. And so if I, have some information such as this that they know, and I've shared with them through our huddle meetings, this information, how helpful this can be. They know I have this information, and during their exams with the patient, if the patient brings up that they have a concern or issue or they need something, then they know that they can come to my office, and then I can, take it from there to help them, with whatever need they may have. If it's something that is beyond my scope, then I collaborate with other professionals. I have a great collaboration with social work. They have access to things that I don't have access to. So I work with them in partnership, because at the end of the day, the goal is to make sure this patient has what they need to be able to have and manage, have better health care.
Bridget, I'm just going to add a couple things. First off, and I apologize for not saying this earlier, but just, speaking on behalf of, my pediatric and other physician colleagues, just how much we appreciate and realize how vital the role that you all play is. So, exactly like you said, look, I can diagnose an ear infection and treat it, and I can do things, but there are things that I just don't have the information or the knowledge base, and unfortunately I'm stuck in my office and I can't get out. So to be able to have community health workers that have that knowledge, that know the community and are able to reach the families where they're at, it's so vital to really, and I think working as a team and you said that word collaborate, right? And I think that's going to be the most successful. one of the things, going back to the original question that you were answering, I would just be sure to ask the families, who do you identify as your child's either pediatrician or family physician, right? Number one, making sure that they have a PCP. And like you said, asking when's the last time that you had your well visit, and making sure that they're up to date, making sure that they have transportation to be able to get to the office, and sort of being able to help that. We have, some caseworkers and community health workers in Cincinnati Children's that will call our office on behalf of the families and help schedule that appointment. So I think just asking and making sure that can they identify who their PCP is, and then following up with when was the last time, they had their well child check.
Yes, absolutely.
Are there some ways that either of you suggest community health workers and home visitors can help build that relationship with the primary care provider and the community health worker? What are some ways that you think would make the partnership flow more easily?
Well, one thing I think, when I'm speaking to the patients, and encouraging them to come to their appointments. Now I know things happen and they may need to cancel or reschedule, but it's really important to come to your appointments and have the conversation, ask those questions to your provider. And then the provider, the providers I work with, I know that they take the time to answer those questions and make that patient feel like, whatever their concern or matter is, it matters, and that we're here to help them as much as possible. And then having that follow-up, once the patients leave, then it's kind of left up to them to do the follow-up on their care, which, yeah, they should to some degree, but with other barriers such as literacy, and, other household or family situations, it may slip through the cracks. So to have someone like a community health worker to call and say, hi, hey, we miss you. Can we get you to come back in? Can we help you come back in? Do you need transportation? What is it that you need that we can help you with, so that you can come in, speak with your provider, or if they can't get to the provider, then I'm able to send a message. And I say to them, well, I will make sure that, I send a message to your provider that you had a question about, whatever the question is, and they will get back to you.
So I think from my sort of take on that question, it's really, it does take a little bit of work, because I don't think, and so in full disclosure, I'm in an independent practice. So, it's a little bit different than maybe a practice or a clinic that's owned by a hospital or owned by the health department. So I'll admit, I don't know often what resources are out there. So it does take a little bit of work on the practice side to sort of figure out what are your resources and how can you connect with different agencies and community health workers. So just a few thoughts I think you can do. I think number one, talking to your managed care representative, so calling up your care source rep and asking them, what resources are available in my community, and can we maybe set up, a brief call? That's one of the beauties. There's not a lot that's come out of the pandemic, but I think the realization that we can be much more productive and we can do virtual meetings, right? And so having a virtual meeting with a community health agency or a community health worker to learn about what resources are out there in your community. I think reaching out to your local, if you happen to live near a children's hospital, contacting the social work or one of the care coordinators and finding out. And I think that's identifying somebody in your office that can, not necessarily a physician or an APRN, but somebody within your office that can sort of do that research and start to collect those resources. For those of you that are in the Cincinnati area, our local chapter of the AAP, the Cincinnati Pediatric Society, on October 14th, we're sponsoring a virtual community health fair, community resource fair, where we've invited 10 different community agencies to sort of in a sort of a virtual, it's almost like speed dating, where you get to sort of meet and they get to present to the healthcare providers what services they offer and how to connect with them. So I think there's lots of different ways. And then hopefully, you know, by participating in programs like this, you know, and from the Ohio AAP, sort of spreading the word out on what different programs, contacting your local health department, I think was a huge step. Having somebody in your office call up and go, what resources do you all have or can help get me in contact with for my family? So those would just be things from sort of my perspective of, I think, things we can do to sort of help, you know, sort of with that collaboration that Bridget had mentioned.
Yeah, that's wonderful. And then there's a question in the chat box. Bridget, you had mentioned your work with pregnant moms. Is there an opportunity during that work to provide families with education, resources about the importance of pediatric well care and set the foundation for that and help make a connection to a pediatric primary care provider for the child?
Yes. So pretty much, like I said, when we have our OB clinic, I work with the MTAs, I work with the provider, I work with the OBGYN, and they refer the patient to my office, and that is the opportunity for me to introduce myself, share what I do, and then provide them with some information. You know, are they aware? Because I'm pretty sure that from their, if they've had their visit with the provider has mentioned, you know, some things that are coming up that they'll need to, you know, make an appointment and come in and get the immunizations once the baby's born. So step by step by step. And then some of the information that's here on the PMP, being able to share that with them and just have conversation with them, not necessarily reading to them, but making sure they are aware, making sure they understand, and then how best can they use that, you know, in their situations and in their healthcare.
That's great. And I think that there's also an opportunity for home visitors when they're going into the homes with children to ask about their vaccines and if they are receiving that lead testing at the 12 and 24 month visits, encouraging them to get that testing done. Because a lot of times with lead testing, like Dr. Peltier had said, if the testing isn't done in the office, a lot of times they're not receiving that. So encouraging them, asking them if they're receiving that lead testing, giving information, asking questions about their child care, if they're with their grandparents or other family members, if there's lead present in those homes. And that is the same for immunizations, asking about their immunization schedule, making sure that they're getting those immunizations, and then education on activity and health, and if they're receiving the proper nutrients, if they're with those family members, if they're able to have healthy foods. I think these are all questions that can be set in the home as well. And then with community health workers in different settings, I think it can go lots of different ways.
If I could briefly mention with the grandparents and the lead, we had a situation about maybe 2 weeks ago. So we have community health worker team meetings. And there was a situation where it was a grandparent. She had 6 of her grandchildren, the youngest age 4, and he tested positive for lead. And so then the task was to somehow get them out of the house and into a safer, more safer environment while, you know, work was being done on the house to remove the lead. And we had run into kind of like a stopgap because in trying to find some place for the whole, keeping the family together, and or, you know, having some place for the 4-year-old to go, it was really kind of difficult in a way because we didn't want to separate him from the grandparents, from the family, and, you know, his siblings, that sort of thing. So I believe we were able to reach out to one of our temporary housing programs to see if they would have the space to be able to house all of them while the work was being done on the grandmother's house, which she owned the house and she didn't want to give up the house or, you know, have to, you know, move too far away from the house. And then within that time period, you know, the child was going to regular provider visits, and they were working on, you know, the lead testing and other immunizations that were needed for that specific child and the other children as well too.
Great, thank you. And then this is a question I'm not sure if you'll be able to answer this, but if you do know, if any WIC programs are doing lead testing anymore.
I just saw that question. We have a WIC program in our building, and as soon as I'm done here, I'm going to go up there and ask them.
Okay, so we will.
So
I will say I do not know the answer. I do not know the answer to that. So
I will.
I'm going to say I don't think, I haven't seen one. So my gut feeling is at least locally ours aren't doing it, but I'm not going to say I'm 100% confident in that.
Yes, I'm not sure. I haven't heard that WIC offices were doing it, but we will find out, and I will make sure that you get the answer to that question. That's a good question. Great. Are there any other questions that we can answer during this time? Thank you so much, Dr. Peltier and Bridget. This was a great session, a great kickoff session to start that conversation. And we are excited about the additional trainings that we are going to be having.
Thank you for the opportunity.
Yeah.
Thanks for inviting me. Y'all take care. Stay safe.
Yeah,
thank you.
Thank you. So just a few follow-up things that I wanted to chat about before we end the training. Like I said before, we have more trainings coming up, and we would love for you to join in them. So our next one is on vaccine health, October 12th. Vaccine hesitancy, I'm sorry. And we'll talk about some more resources that are available, and we would love for you all to join this. And we also wanted to thank CareSource again for their support and funding for these trainings. We're excited to really kick these off and have you all attend more. And all the resources that were talked about during today's training will be provided in a follow-up email, as well as the recording to the training and the slides. There will be a post-survey evaluation sent out, and that is how you will receive a certificate for attending. There's CME available for this training, and you can also use that certificate to receive your credits if you're a community health worker or social worker. And then if you have any questions, if you need anything, please feel free to send me an email or give me a call. I'm always willing to help and connect you all to any resources that you need. And we love your feedback. So we would love to have more information on what you all would like to see during these trainings. So please let us know how we can help. Thank you all for joining today. And please let me know if you have any questions. We're excited to have you all come to the rest of the trainings. Thank you all so much. And thank you again to Dr. Peltier and Bridget and to CareSource. And the registration training was just put into the chat box. So go ahead and click on that, and you can register for the rest of the trainings that we have.